Good afternoon, and I'm the past president of the International Academy of Oral Medicine and Toxicology, and that I conducted a risk assessment on behalf of the Academy back in 1998, and that one of the things that we get into is dose, and one of the things that the fluoridation people never want to talk about is dose. Why is that? Because in toxicology they say dosis sonum bonum facit. Dose alone makes the poison. And so here's the recommended dose for a baby. None. So water fluoridation delivers to an infant a dose of fluoride that would be gross malpractice if any physician, family physician, dentist, or licensed practitioner in the state of California were to write a prescription for that amount. Therefore, you have a duty to inform the parents about this increased dose beyond what the family doctor can prescribe and warn them to not make up tap water formula. I thought water was supposed to be safe for all of us. Even the ADA agrees. They warn their members, not you, not the water districts. Of course they recommend fluoridation, but they tell members to tell their parents of children to make up tap water formula with fluoride-free water. Make up the formula with fluoride-free water so the baby won't get fluorosis. Interesting they use the term fluorosis. It's not dental fluorosis. Fluorosis is the body, joints, ligaments, tendons, brain, what Dr. Thiessen was talking about, the endocrine system. When you overdose infants with fluoride, you cause adverse responses systemically. And even the advocates for fluoridation agree that if it works topically, not systemically. But systemically is dental fluorosis. And when you can see spots on children's teeth, you've got to be a dentist to believe you've poisoned that child enough to cause spots on their teeth, and that's the only organ that was impacted. The level of dental fluorosis in the community is proportional to the level of fluoride in the water supply. That's because people drink the water. And the exposure to fluoride is what causes dental fluorosis. So your decision to add fluoride to the water supply will increase the number of children with dental fluorosis. In California, dental fluorosis is a proven adverse effect, and it costs a lot to fix. Dr. Nelson's talking about $1 billion for dental care. There's more than that spent on fixing funny-looking spotted teeth. Don't take my word. Open up the yellow pages. Bleaching and other methods to fix teeth that are discolored by fluoride in the water supply. And you've been very generous, as you've indemnified the California Dental Association and Dr. Nelson and everybody else that told you to put it in the water supply for any adverse effects. Thank you very much. But the only way to get around that is for you to warn the recipients of your water that it's no longer safe for the population to drink. Scott Peters is the chairman of the San Diego City Council that had just heard my Poison Babies presentation. And this is an informational meeting where they're going to listen to the advocates for fluoridation and how good it is to allow that to be added to the San Diego City water supply. Hydrofluosilicic acid is the product they're going to use. And that when Scott Peters asked the advocates if it's going to poison babies, listen to what they say and how they try to spin the answer.
I just had one question. This is not necessarily for you, actually. It's the one I picked out of the parade of doctors, but anyone could answer this question. It's specifically the baby issue and the baby formula exposure issue. Can someone address that if there's data on that?
I'll answer that.
I heard your view of it. I just didn't hear the opposing view. And then say which doctor you are when you.
Okay, I'm Howard Pollack.
Okay, go ahead, sir.
I'm at UCSF. Your question is with the baby issue.
There was a concern that the level of fluoridation was too high for babies to drink, and
right. And the American Academy of Pediatrics recommends breastfeeding for infants. However, the majority of children are not breastfed, and ever since time began, almost there's been alternatives to breastfeeding. So we recognize that with increasing knowledge and science base in terms of fluoride intake from all sources, that young infants, when they are receiving powdered infant formula or formula that's concentrated and has to be diluted with water, that young babies will receive a lot of water, and some will receive higher than what is considered to be the tolerable upper intake, whereby after in excess of that, there's a chance of developing dental fluorosis, white streaking of the teeth, as those teeth are developing. And so this guidance was issued in as you've heard, to provide information so that risk can be balanced with the risk for tooth decay when considering what kind of feeding practices should be used for infants. If infants are using the ready-to-feed formula that doesn't need dilution, then there's no issue. So that when using an infant formula that needs to be diluted, we're recommending using distilled water that is available at stores.
So you'd recommend just has no chemicals in it?
That's correct.
Okay, excellent.
Distilled water? You want mothers to go buy distilled water for their babies because the stuff you put in the water will poison the baby? That's un-American. Edgar Dimely makes a living trying to suppress those anti-fluoridationists that might question the wisdom of adding hazardous waste from China and Mexico to the public water supplies. And he knows when he's traipsing on the edge of the law that San Diego has, that it does not allow us to pay to buy hazardous waste and put in our water supply. And watch how many times he tries to deceive a city council woman who knows the correct answer to his question.
Good morning, Mr. President, members. My name is Edgar Dimely. I was just stated, I'm a staff member with Metropolitan's Water Quality Section, and part of my responsibilities has been to help our member agencies and their retail agencies implement our drinking water fluoridation program. On February of 2003, as most of you know, Metropolitan's Board of Directors adopted a policy to fluoridate its treated water supplies. Essentially what that meant was they directed staff to move forward with the design, construction, and installation of facilities to fluoridate at our 5 treatment plants. Not long after that, Metropolitan was granted the amount of money at the time to design our the estimated amount to fluoridate at our facilities. We were given approximately $5.5 million for the planning, design, and purchase of those facilities from a group that's detailed below there. You will hear reference to the operation and maintenance cost, and just to take it off the table, Metropolitan is paying for that. That is not being offered to us. That is not part of the $5.5 million in capital costs that we receive. The O&M cost is being paid for by Metropolitan. I'm going to now transition into some of the outreach issues that I think you might be interested in. Again, part of our job now is to make our message consistent. We not only supply water to the San Diego County area, but also to our rest of our service area, over a 6-county service area. And it's important that the message that we say here in San Diego is consistent with the other portions of our service area. And we've been working with our member agencies and their retail customers in refining that message so all of our customers hear the same thing. We're also providing support to our member agencies and sharing information, news inquiries, et cetera, public inquiries, again, so that when we go online in October, that all of our customers and their member agencies are hearing the same thing. And again, the attempt there is to minimize the amount of misinformation that's out there and quickly counter critics and others who have had issue with this practice.
And then the question is for Matt on the cost to fluoridate at your treatment plants. What is the estimated cost to fluoridate your supplies per acre foot of water treated?
I will quote an estimate because we can't give the exact cost because we haven't started fluoridating. We have some estimates that have been done over the years, But the number I've been quoting, and again, it's an estimate, it's a range, it's slightly less than $2 an acre foot.
Okay, so your cost per acre foot is slightly less than $2.
The estimated operation and maintenance cost, yes.
All right. And so as part of that, when the County Water Authority purchases water from you, do you or will you increase your costs per acre foot of water to offset the costs that you will be using for the fluoridation of our water?
It's my understanding, and I'm not a rate structure expert, we can get one, but we have certain components of our treatment, and the normal cost of treating water is part of that structure. This is viewed as part of that normal cost. We do other treatment. We use other treatment techniques like ozone, chlorine,
Right.
other additives.
And
this is part of that quote-unquote treatment cost.
Right, I understand it's part of that
But to
treatment
specifically
cost. Yeah.
answer your question, that cost will not be passed along to the County Water Authority or to any of our 26 member agencies. It's incorporated as part of our normal treatment cost.
So there's no addition, you say that there's an additional cost to treat the water, but that you're just going to absorb those costs? And so there will
correct.
be no increased costs to County Water Authority for any of your treatment? In other words, the costs of treating the water are not going to be increasing by MET at all
And I'm
for
trying.
your treatment costs, right?
When we go online with this, the County Water Authority will not see a incremental increase as a result of our startup. It's incorporated as part of our normal treatment costs.
So in fact, there will be increased costs because the cost of your treatment will go up, and as the cost of water treatment go up, those costs will be passed on to MET, or on to County Water Authority.
And I want to be careful not to be misquoted or mischaracterized.
I'm just trying to understand if there's an increased cost for treating.
There is a cost associated with this, and as I
Okay.
mentioned, the approximate cost is
Right.
about $2
Per acre foot.
Per acre foot. But again, that's as part of we have other treatment costs, and when chemicals
Right.
go up, that cost goes up as well. And
Okay.
Okay.
So if you had to add chemicals, and the cost of the chemicals are roughly $2 per acre foot, then my guess is your treatment costs for the water treatment go up.
That's correct.
All right, simple, thank you.
Next, you'll hear from Dr. Kathleen Thiessen. She's an expert on risk assessment, and she works as one of the directors for the Cenis Oak Ridge Center for Risk Analysis in Tennessee. She served for 3 years on the National Academies of Science review of fluoride in the drinking water as an expert in endocrine function, how your glands work, how your hormones work, and whether or not fluoride affects those. Listen to Dr. Thiessen explain to you the dose of fluoride and how that relates to levels that are known to cause harm from water fluoridation.
Thank you for this opportunity to address the committee. I understand from Mr. Dimeli's presentation that your plans to fluoridate are in place. I wish simply to inform you of some of the implications of those plans. The first graph illustrates the expected range of consumption of public tap water for various age groups. This is information from the Environmental Protection Agency in quantities of milliliters per day. These ranges include only people who actually consume tap water. And you need to note the red diamonds indicate that some people consume substantially more water than the usual range. The total consumption of community water shown here is not to be confused with total fluid consumption or total water consumption. It does not include well water, bottled water, or commercial beverages. The second graph shows these same ranges per unit of body weight. So milliliters per kilogram of body weight. Note that infants have the highest tap water consumption per unit body weight, with some infants reaching more than 250 milliliters per kilogram per day. That's a half a cup per pound of baby. In general, the people with the highest tap water intakes include babies fed formula made with tap water, people with certain medical conditions, people in unair-conditioned residences, people who work outside in hot climates or do heavy physical labor, and athletes. This graph shows the estimated fluoride intakes for each age group. This is based on the water ranges shown in the last slide, assuming 0.8 parts per million fluoride, which I understand is the plan for this area. and also shown that red vertical line is EPA's reference dose at 0.06 milligrams per kilogram per day. This is defined as an estimate of a daily oral exposure to the human population, including sensitive subgroups, that is likely to be without an appreciable risk of deleterious or harmful effects during a lifetime. For fluoride, as I said, the reference dose is 0.06 milligrams per kilogram per day. As seen in the graph, many infants have a fluoride intake just from tap water well above that reference dose. Older children with high water consumption will also exceed that, and even adults and teenagers, the highest water consumptions come very close to that. Note that this graph shows estimated fluoride intakes only from tap water. It does not include other sources such as commercial beverages made with fluoridated tap water, or toothpaste, tea, or food. When these other sources of fluoride intake are included, total fluoride intakes for many members of all age groups will exceed EPA's reference dose. The final graph shows the estimated fluoride intakes from tap water from that last slide, plus estimates of no effect levels for a number of adverse health effects, many of which were described in the National Research Council report, which was put out last year. I was one of the authors of this. These no effect levels represent fluoride intakes at or below which most people are not expected to experience any harmful effects. Note that these estimates are based on population averages. They do not include a margin of safety. They might not be protective for everybody, and intakes above these levels cannot be considered safe. You need to notice that most of these no effect levels are below EPA's reference dose, indicating that EPA's reference dose is not protective of many of these health effects. Note also that most of these no effect levels are exceeded or will be exceeded by many members of the population with fluoride at 0.8 parts per million in community drinking water. When other fluoride sources are included, even more people will exceed the no effect levels. In order to be safe for all members of the population, fluoride intakes for all people must be kept below the lowest no effect level when all sources of fluoride intake are included and with an adequate margin of safety. This list of adverse health effects does not include cancer. A carcinogenic or cancer-causing effect of fluoride cannot be ruled out from the available data, and at the very least, a cancer-promoting effect is likely. For carcinogenic substances, the risk of cancer increases with the amount of exposure, such that even a very low exposure carries with it some cancer risk. In conclusion, I'd like to quote from a director of laboratories from the City of New York, Department of Water Supply, Gas, and Electric, from a presentation in 1956 that's still relevant today. It is obvious from the knowledge of fluoride toxicity that an appropriate factor of safety cannot be established when fluoride is added to the public water supply at the level recommended by the proponents of fluoridation, and must be concluded that the fluoridation of public water supplies is a hazardous procedure. People are bound to get hurt. It remains to find out how many and when. So I'll be happy to answer questions later. Thank you for the opportunity.
Do the board members have any questions of Dr. Thiessen? Seeing none, thank you, Doctor.
No questions? No question to ask their expert, Dr. Kathleen Thiessen? They invited her to speak and explain to them what the National Academy of Sciences determined. She explained that they're going to be poisoning 64,000 babies. And they couldn't think of a single question to ask? How do these people get their jobs? Yes, good morning. And I just wanted to let you know that the rate increase that the so-called pass-through from the Metropolitan Water District is a substantial portion of that is for infrastructure and for the purchase of a product called hydrofluosilicic acid from China and Mexico to treat the water, not as a water treatment, but as a medical treatment for the citizens of San Diego. That I particularly like the method of voting. I understand you don't have any real control over it, but Hamad Karzai could be reelected as mayor of San Diego with that method, because every water supply meter got a ballot, including all of the city water meters. And what they do is they count the number of people that say, no, that's not a good idea. And so if somebody's dead or gets thrown in the trash or they go on vacation, that was a yes vote. So you got to affirmatively vote no in order to say, you know, this is not right. So I call that the kangaroo vote. It's fairly undemocratic, but thanks to Donna Fry, careful questioning of Edgar Dimely in this city council chambers, he, speaking on behalf of the Metropolitan Water District, acknowledged for every person here, after he told a falsehood on 3 occasions, he finally admitted, after Donna nailed him, that the cost of adding hydrofluosilicic acid to the water was going to be wrapped up as water treatment and charged to the citizens of San Diego. Howard Pollack, speaking on behalf of the California Fluoridation Task Force, admitted, upon questioning by Scott Peters, that it will harm a baby. Why is that okay? Are you telling the recipients of the water it violates the Safe Drinking Water Act? Are you telling mothers who have to go back to work that making up a formula will give this baby 25 times more fluoride than the National Academies of Science reported damaged thyroid in 2006? This isn't 1950s technology. What's damaged thyroid result in? Lower IQ, learning disorders, obesity. Sound familiar? And the city council likes the water here in San Diego so well that I went around and I looked in the offices, and I was not surprised to see bottled water in the vending machine in the hall and in all the offices. Is the water so safe? A lot of people say, oh, well, it's not a problem for me. I'll drink bottled water. But don't you bathe? Hydrofluosilicic acid goes right through skin. That's how they used it in the 20s and 30s to suppress thyroid. They gave people a bath in it. And the sad part is, despite the claims to the contrary, putting this substance in the water causes disproportionate harm. Disproportionate to the poor who cannot afford to buy water for their baby. Disproportionate to the people who may not know that the water is contaminated with hydrofluosilicic acid. Disproportionate to African Americans who, for reasons that are not clear, suffer a 6-fold increase in blood level of lead when hydrofluosilicic acid is added to the public water supply. There are not one study, there are 2 studies with over 500,000 children in them showing that's the case. If there's any other source of exposure, such as older housing, does San Diego have some older housing that might have some African American children living in it? Are you going to tell them that the water's no longer safe to drink? Hispanic children had a 4-fold increase in children with above 10 micrograms per deciliter lead. Well, you may like fluoride, but do you like children with high blood levels of lead? It causes learning disorders, violent behavior. Do we have any problems with that? You may all claim that your hands are tied. Oh, I'm sorry, I can't do anything. But you know, we have representatives on the Metropolitan Water District board. And when they voted to put this hydrofluosilicic acid in our water, one member didn't even go. The other one voted for it. We have a law against it. And our representatives are saying, yeah, let's get that stuff from China and Mexico that's contaminated with arsenic and lead and cadmium and put it in the water for the babies to make their teeth strong. Give me a break. That's lost in every single court battle. It's not for the children. It's for the industry that has the product to get rid of. Fluoride exposure in humans is associated with the elevated thyroid-stimulating hormone concentrations, increased GORDA prevalence, and altered T4 and T3 concentrations, similar to the effects of T4 and T3 that are reported in animals. Very consistent results. It happens in humans, it happens in animals. And at the dose that are 25 times lower than a baby on a bottle. 0.01 milligram per kilogram. The baby gets 0.25. Thank you very much.
Thank you, sir.
Yes, good morning. For the record, my name is Jeff Green. I'm the National Director for Citizens for Safe Drinking Water, and I'm here to make a formal statement of basically both actual and constructive notice that your Proposition 218 notice is not in compliance with Proposition 218. It's a continuing action that occurred back in 2007 as well. And to make it very clear, some of your questions that I heard from some of the council members were right on. What were the costs that were being passed through? For those of you who are not really clear about what Dr. Kennedy had related to, Section 67 of the Municipal Code prohibits fluoridation of the water supply. The only way that the city or anyone else could be fluoridated with a municipal code like that is if the state law would supersede it. The only way that the state laws could supersede it is if it met all of the conditions. One of the conditions of the state law is that no city could be compelled to fluoridate unless all of the funds came from other than ratepayers or taxpayers. And exactly what you're passing through right here on costs are not pass-throughs for water. And in fact, Proposition 218 is very clear about what water is. And if I can read the statements it has to do with it, it's services related to potability, preservation, storage, or distribution. Not one of those words relates to something that fluoride does, because fluoride's intended to affect the physical structure of people's teeth so it'll be more resistant to tooth decay.
And so there you have it. Everybody on the planet admits you're going to poison a baby if you put this in the water. And the title of this video is, why is that okay? Why is it okay to poison babies? You know, if I went to your local school with a brown bottle that had a deadly poison in it and started putting a few drops in your children's lunch, you'd call the police. But if the city council does exactly the same thing with exactly the same product, everybody sits back and says, well, you know, it's been approved. Approved by whom? Nobody approves this. Even the American Water Works Association, their approval was found to be false. They didn't get the required documentation of the products by a congressional investigation. So, hey, why is it okay? We're admitting we're going to damage babies. That's not the only group, but that's the one everybody agrees on. This used to be a controversial practice. It's not controversial anymore. It's going to poison the baby. Why is that okay?